Hi staff and faculty, welcome to our virtual bloodborne pathogen and infectious disease training, everybody's favorite training of the school year. In this training, we're going to talk about what an infectious disease is and what a bloodborne pathogen is. We're also going to look at the use of personal protective equipment, which will also be demonstrated in our teacher meetings this week. We are also going to talk about how we will clean up a bloodborne or a blood spill or a bodily fluid spill. We're also going to talk about this site exposure control plan and then how you would report any exposure that you might have had in your classroom. I always like to say every year when I do this training that I don't make this slideshow. So bear with me as we go through this. It's a slideshow that I have to go through and I have to train you guys, but it's not necessarily a slideshow that I put together. The slides are very wordy, so I'm just going to touch on things on each slide. If you need to pause to read, you most certainly can. If you don't need to pause, you can just keep moving forward. So just keep that in mind as you're going through this video. So an infectious disease results from microbial agents, viruses, bacteria, fungi, maybe parasites, things like that. And this can be spread directly or indirectly from one person to another. So I also want to bring your attention to these things that are in yellow. Anything that you see written in yellow is important, and you will see it again on the quiz that you have to take at the end of this training. So if you want to take notes so you don't forget anything, you can write anything down that you would like so that you remember it for the end when you take your quiz. Now, bloodborne pathogen is any hazard that's carried by the blood. And maybe we may, or a student may be exposed to a bloodborne pathogen if there's a cut or a bloody nose that results in blood getting on a surface in your classroom. Now, most times it is going to be a cut. It's, you know, if you're working in the lab, you're dissecting something, maybe somebody cuts themselves with a scalpel and you have that kind of cut. I've also had children get bloody noses in my classroom as well. So those are the types of things that would be, you want to take special care when you're cleaning up so that you don't get exposed to a pathogen that could possibly be in the blood. Now, how does this exposure occur? Now, most likely it's not going to occur from a contaminated sharp item. Maybe this would happen with the nurse if a student has to take insulin or things like that, but most times we're not going to have contamination from a needle stick or broken glass necessarily. Most of it's going to be contact with mucous membranes, or it's going to be you have a cut, you touch contaminated blood, and that blood got into your cut. So those are the ways most likely that you would come in contact or be exposed to these pathogens. Now I'm quickly going to go through some of the bloodborne pathogens. I do this quickly because these slides are very wordy, but hepatitis is a big one. This hepatitis A, B, and C, they're all liver diseases caused by different hepatitis viruses. Hepatitis A is a hepatitis A virus. It's transmitted through fecal matter. There is a vaccination for this, and it's recommended that all children get this vaccination starting at age 1. If you're traveling to another country, you may want to also have this vaccination. Hepatitis B, HBV, again, it is a liver disease. It can have serious long-term effects, but it also could be very mild. This is transmitted through infectious blood, other bodily fluids. It can also be sharing contaminated needles. An infected mother can also pass it to her newborn. There is a vaccination for hepatitis B, and it's recommended for infants, older children, and adolescents, and that will help that transmission, that you don't get hepatitis B. Most babies get that when they're infants. If you don't have it when you're an infant, then you may need to get it when you're an adult. Hepatitis C is HCV, and this is a chronic condition. It can lead to cirrhosis of the liver or liver cancer, and again, this is transmitted through the blood, so a bloodborne pathogen, and there's no vaccine for hepatitis C. HIV is another infectious agent, and this is also transmitted through bodily fluids, blood, semen, breast milk even. So HIV again would be another bloodborne pathogen. TB, however, is also an infectious disease, but it's spread by airborne droplets. And we've had a whole lot of talk about COVID. I'm sure you can't miss it. It's on the news. Gerard's going to give us a nice presentation on COVID. Tuberculosis is spread in the same way, by these airborne droplets. That's why we're all wearing masks, so that if a person does cough, sneeze, speak, or sing, they are not going to be spreading any of these droplets to anybody else. Where it's getting on a table and maybe you're touching that table and you are then touching your eyes and you're getting the infectious disease spread in that way. That would be an indirect. A direct would be where you somebody sneezes right on you and you the droplets go right into you when you breathe in. So that would be how that is transmitted. So we can take preventative measures. We can use our PPE, or our personal protective equipment, which you all saw me demonstrate in class. So these next several slides I'm just going to quickly go through, not waste a lot of time on them. But we are going to talk about the mask, the goggles, and the gloves. Gloves being probably the most important. The mask and the goggles are optional in my opinion, unless you have a huge spill. If somebody vomited and you should have a mask on for that, and possibly goggles, but definitely always have the gloves on. You want to make sure that you put the PPE on before you come in contact with any of the fluid and the person, because you don't want to spread that contamination. And you also want to make sure that you discard any PPE into the trash can and then perform hand hygiene. So washing your hands is very important when you're done cleaning everything up. So we've already talked about the sequence for placement. So you put your mask on, you fit your goggles on, and your gloves. Again, you decide what you need for the situation that you are in. If you think you just need gloves, then just put the gloves on. Again, we're all going to have masks on this year, so that you already have on. You don't necessarily need the goggles again unless it's a big spill. So we're going to move on. I'm going to teach you how to wear that mask, how to put the eye protection on, and then how to put the gloves on. I do want to just remind you, when you put the gloves on, you want to bring them up as far in your wrist as possible. If you have long sleeves on, put those gloves over top of the cuff of that sleeve, just to help protect your skin so that you don't get anything on your wrist and possible exposure. You want to make sure that once you're all in that PPE, that you don't touch your face, because what if you have contamination on those gloves because you've been moving the student to an area to keep them away from others, and then you go and touch your face. You don't want to do that. That's where you could have that transfer of bacterias or pathogens. If your gloves tear, you want to make sure you take them off and you put another pair of gloves on. Wash your hands before you put those new gloves on, and then limit the surfaces that you touch, because anything you touch you've now contaminated and you now need to clean that area. So limit what you touch. You must decontaminate surfaces after a spill has occurred and you've cleaned up the spill. Then you need to decontaminate. Now, there is an infection control plan for decontamination and cleaning on the work site. that is something that is kept in the main office. And basically what that's telling you is you need to decide how you're going to proceed cleaning up. The cleanup procedure is going to be based on where the spill is, what is being cleaned. Is it a floor? Is it a desk? That kind of thing. Is it the type of soil is next? Is it blood? Is it vomit? What are we cleaning up? And then you will go about taking the proper procedures to clean up that contaminated area. You'll notice that last slide was all in yellow, so that's super important for the quiz. We also have a Bloodborne spill kits, I believe. I know there's one in the main office, and I believe there's one in the cafeteria as well. In that Bloodborne spill kit is everything that you need to clean up a spill. Now, I've had bloody noses in my class. I don't send somebody for the Bloodborne spill kit. If you can clean it up with paper towels that you have in your room, and your gloves, your personal protective equipment is in your room, which you will have, you do not need to call down to the office and have somebody bring anything up from there. That would be if you have a huge spill, you would call the office and you would have them bring things up. But know that it is there in case you need it. Now you want to make sure if somebody does have a bloody nose, I've had this happen in my classroom, especially in the winter when the air is very dry in the school, kids will tend to get bloody noses. You want to make sure that you get kids away from them and you barricade off the area where they are. You put your personal protective equipment on. You can wipe things up with a paper towel, or better yet, a Lysol wipe. Pick it up and throw it in the trash. You don't need to put anything in a biohazard bag unless it is a huge spill, a big cut, and there's lots of blood in the area. A simple bloody nose is not going to have a lot of blood that you would need a biohazard bag for. You can put it in your trash can, you can close up that bag, and you can discard it later, just as long as it's closed up. After you clean up the spill, you want to take a disinfecting agent and you want to clean the affected area with that solution. That can be as simple as more Lysol wipes. It can be as simple as a bleach solution, but most likely in the classroom you'll be using what we give you this year for cleaning your desks. So you can just spray that, wipe it up, and throw that in the trash that you threw out the paper towels that you cleaned up the spill with. The bleach solution, if you needed to make one, or if that's what we were using to clean up, would be a 1 to 10 concentration. You see there that it also says approved commercial disinfecting agents, which you will all have in your classroom. So that's what you're going to be using this year. You don't need to worry about the bleach solution, but it is in yellow, so you do need to remember it's a 1 to 10 solution. Now, when you remove your PPE, the first thing you want to take off are your gloves. You want to take off your goggles next, and then your mask if you used the goggles and the mask. And again, that was shown to you in class, or in our training, during our teacher training during the our first week of school. So I'm going to quickly go through these slides. Not much needs to be said here. To take those gloves off, you just want to be mindful that you take one glove off, put that glove in the gloved hand and hold on to that, and then you pull off the second glove and wrap it around, and you have this nice little bag that you can then put in the trash can where you've put all of your other waste. And then you want to remove your goggles, you want to remove your mask. If it's a disposable mask, you want to make sure that you throw that away. If it's not a disposable mask, you want to make sure that you wash it if things were contaminated on your mask. Now, like I said, as long as you have a small spill in your classroom, all you need to do is close that bag up, tie it up, and put it aside for the trash. If you have a huge spill and you needed a biohazard bag, which this is my 8th year at Central, never have I seen us use a biohazard bag. But if that would happen, that biohazard bag goes with the injured student, faculty member, staff, whoever it is having the issue, that bag would go with them because they are going to the hospital. So, but again, like I said, for most of us, we're just going to be throwing things in the trash and closing it up and then putting a new trash bag in our trash can. Now, you also want to remember to wash your hands. When you take all your PPE off and you get everything thrown away, everything's cleaned up, wash your hands with soap and water. If you don't have soap and water available in your classroom, please make sure you use hand sanitizer. And then when you have a chance between class, run and wash your hands. Okay? So you want to make sure that you get that done. Again, I can't stress it enough. You see it on this slide. It's underlined for you to do. Now, something that I like to make sure that I tell everyone is you never want to take a chance. If you have a spill in your room, you must put that PPE on because you do not know. You can't see a bloodborne pathogen. You don't know if that blood is contaminated. So you want to make sure that you always, always, always use your PPE. Again, I can't stress enough, size up your situation. If you only need to put gloves on, only put your gloves on. If you need to suit up and put everything on, put everything on. It's all based on the situation that you are in with that student. Now, the exposure control plan is also something that we have at the school, and basically what it tells you is what to do if you become exposed to blood or other infectious materials. So it's going to tell you what training, what vaccinations you might need, paperwork you might need to fill out if an exposure does occur. This plan is looked at every year, at least annually. If any changes need to be made, that's a diocesan thing. They change that, and then they just give us a new exposure control plan for our building. So that's just something that you need to know. We have it there, and it's for your protection for if you would be exposed to a bloodborne pathogen or blood in general, or any other fluids. So again, the post-exposure follow-up, part of the exposure control plan, this is just documenting how you were exposed, where it occurred, how it occurred, and if you would need to go get other testing done after the incident occurred. That would be some of the follow-up things that you would need to do if you were exposed. Maybe you would need risk counseling, things of that nature. Again, this is all in that exposure control plan in the event that you would have an exposure. So if you want more information on that control plan, you can go to the Allentown Diocese website, which is listed there for you, and you would be able to read through that if you want more information, especially if you did have an exposure. You would definitely want to be looking into that. Now, the last thing that we need to do is our skill checkpoint. So this is the quiz. So on the next slide, there's going to be a link to a document, and you are going to need to fill out that document, take the quiz, sign everything, and hand that in to Margie by August 31st. So that goes in your file to say that you have this training. There's two ways that you can do the paperwork. You can print it out and you can handwrite everything in and give it to Margie, or you can fill it out electronically and you can send it to her via email and she'll print it out and put it in your file. So either way will work. All right, that's it. The next slide, you'll want to link up to the doc, take that test, and hand everything in to Margie by the 31st. I hope you enjoyed the training. If you have any questions, you can stop by and ask. But again, you'll be getting the actual training on how to put gloves and other personal protective equipment on live the week of our first week of school as teachers. All right, guys, that's it. It's been fun.